with Dr. Carlos Del Rio. He's an infectious disease specialist at Emory University School of Medicine. Dr. Del Rio, it's good to have you back. And I mean, it seems like stating the obvious that the vaccine is only going to be available at first to those who need it most urgently and then to the rest of the public. But the question is, how slow or how quickly do we expect that rollout to be?
Well, I think you heard, and there were several important things that were said today. Number one, you had the graph of the enrollment. You got to realize that a lot of the vaccines, you need 2 doses. And while we are in many of the trials already enrolled close to 30,000, we're nowhere close to getting to 2 doses on 30,000 people. You got to get 2 doses in people. And then from there, you start looking at who develops disease, who develops progression of disease, and who are the outcomes. And as the CEO of Moderna says, if we are successful in public health and you start decreasing the transmission rate, then the date of the interim analysis is pushed back from October to November to maybe December. So there are too many moving parts here. But let's suppose everything went well and you had results in late October, early November that allow you to say, okay, this vaccine seems to be working. Then you have the issue of supply, and then you have the issue of deployment. This is a vaccine that is going to need refrigeration. This is a vaccine that is going to need 2 doses. This is a vaccine that you got to get to millions of people. So the reality is that Dr. Redfield is absolutely right. We may have a vaccine initially for a few people in November or so, but really getting it to the great majority of Americans, if we're very good, it's going to be second or third quarter of 2021. Yeah. And that's why the vaccine is not a switch. It's not we have it and we're done.
It's not a switch, but I think having it deployed across some of the population at all is probably helpful. Let me ask you about some of the side effects that were reported in the AstraZeneca vaccine trial about transverse myelitis, pretty serious disease. Does it concern you that this cropped up?
Well, transverse myelitis is a very rare condition, and it has been associated with some vaccines. When we had the 2009 H1N1 vaccine, there were rare cases of transverse myelitis. It's really hard to know if this is due to the vaccine or something else, pure coincidence. I could have gotten the vaccine and then crossed the street and be run over by a car. That doesn't mean that getting run over by a car is a side effect of a vaccine, but that's how it looks like, right? So you have to decide whether this is something rare or this is something that is going to start happening. And I think many of those rare side effects, you will only know about them until you've gone into the public and you really have the post-marketing vigilance of the vaccine. But the reality is that the fact that the AstraZeneca study was stopped, was put on pause and analyzed, is exactly showing that clinical trials work, because trials are about safety and efficacy. And when there's a safety signal, investigators slow down and then take a pause and look at the data and see if it's pertinent, if it's prudent to proceed or not.
Dr. Del Rio, seeing all of the pressure being put directly on FDA Commissioner Dr. Stephen Hahn by the president, I mean, he tweeted directly at him at the end of August, and then also seeing that the FDA Commissioner had to walk back comments about the benefits of convalescent plasma. The FDA issued and then revoked emergency use authorization for hydroxychloroquine. Are you confident in the FDA standing up against any political pressure to approve a vaccine before the career scientists at the FDA are convinced that it's safe and works for the American people?
I am confident that the FDA has very good career scientists that are there to do the right thing. And, the companies issued a statement, all the companies together issued a statement saying we're not going to go forward until we have completed the data and we have good data. But there is political pressure. There's no doubt about that. And my only hope is that Dr. Hahn and the appointees in the FDA stand up and basically say, no, we cannot have political pressure lead the FDA into making a decision. It has to be science that leads the decision. The American public's health depends on the FDA doing their job.
So I want to follow on what Meg just asked you and what you just answered there. So I don't mean to put words in your mouth, but it sounds like you are saying that you are worried that politics either are or could impinge on science. Am I understanding you correctly?
Politics have already impinged on science. We have evidence of, the approval of the convalescent plasma right before the Republican National Convention. We have evidence that, there was meddling into the CDC MMWR, something that none of us ever thought it could potentially happen by somebody, a political writer. So I think there's already plenty of evidence of political interference in science. So if that has happened up to now, why will it not happen again?
And finally, what is the probability that we have not just one vaccine, but several from several companies?
There's a good possibility, and as Dr. Fauci has said, we need many shots on goal, but we also need many of those shots to be goals, right? We're going to need more than one vaccine to vaccinate millions and millions of people around the world.
Very clear. Dr. Del Rio, thank you as always. Meg Terrell, thank you as well.